Okay, more now on the discussion on what's actually in these health care proposals. And joining me now, Texas Republican Michael Burgess, a congressman and a medical doctor, and also Representative Earl Blumenauer, Oregon Democrat, joins us from Portland. Okay, so let's talk about some of this. Before, I want to dispel some of the myths that are out there before we take questions and continue on. This idea of the death panel, not so. That we're being told that's completely not true. Abortions paid for by this plan, not true. Hang on. The language in the House Energy and Conference bill that their federal money cannot be used for abortions. Seniors losing their doctors or waiting in lines, not true. This is actually good for seniors. Now, that's what the independent studies have said about this. Now, on the Republican side and the Democratic side, they're saying completely opposite and fighting for this and fighting for that. Can't we get past that, guys? And just work it out for the American people. And I say that
end-of-life issues should not have been included as they were in this bill. We had not a single hearing on it. If it is as simple as what you say, Don,
that's not true.
I think
that is not
why does it have to be 10 or 15 pages in the bill? Why can it not just simply be a simple statement?
Okay, here's the thing. I think it's okay. I think it's okay for you guys to debate. Hang on, Congressman. I think it's okay for everyone to debate end-of-life coverage. Don't call it death panels, though. That's a buzz phrase.
But the notion that that was not debated, that it wasn't part of the committee process, is absolute lie. I'm on the Ways and Means Committee. This is a Medicare provision that Ways and Means has jurisdiction over. I introduced bipartisan. No, Medicare is Ways and Means jurisdiction.
Part B is Energy and Commerce.
Hang on, let him finish, and then you can go ahead.
And we introduced this legislation. It was bipartisan. We had testimony over it. I have Republican co-sponsors, including his Republican doctor colleague, Charles Bustani. Some of the most moving testimony for the need to give seniors this choice came from Republican members of Congress who felt that their parents hadn't received it. So it's not true that it wasn't debated. It is supported across the board by the AMA, by AARP.
Let's let Mr. Burgess get in on this.
I'm sorry, but I just wanted to clarify.
It's not a choice. It is the ability to provide education. And no one would disagree with paying the doctor to provide that educational event. I would, in fact, even go so far as if a patient or a beneficiary wanted to avail themselves of the education, that we ought to give them a break on the premium. But where it got convoluted was Congress couldn't help itself, and it had to say, we're only going to pay the doctor to do this every 5 years.
No, it's
figuring
not.
that the doctor is going to game the system.
That's the end of that subject. We're going to take some questions and some comments, guys. Hang on.
10 pages to go through this.
Okay, guys. At least every 5 years, read the section.
I feel like I'm at a town hall right now.
Well, so when people don't read the bill and they misrepresent
look, Earl, in all honesty, this bill came up after July 15th. You guys wanted to pass it before the August recess. You didn't want people to read this bill.
Okay, so listen. All right, stop it, really, both of you. Here's the thing. This is why people are so upset. Because when you look at half of all the foreclosures in the country, you look at half of all the bankruptcies, you know why it is? It's because people have problems affording health care. They have to go into foreclosure, they have to go into bankruptcy because they can't afford their health care. And you guys are arguing the points on the conservative side, arguing on the liberal side. Can't we just get beyond the partisan and just get this done for the American people instead of arguing like this?
If we had this as an open process at the beginning, if we had wanted to tackle what is the #1 issue out there for people, it's pre-existing conditions and losing their insurance when they get a tough diagnosis. We could fix that. We could fix that in a bipartisan way. We could have fixed it before we went home for August.
All right, so why don't you do it? Why don't we do it?
Maybe Earl can tell us why the Democratic leadership would not open the process up and let us fix the problem that's actually ailing the American people.
There were efforts in our committee, and people can go back and they can look online and look at the committee hearings. They can find that there were efforts, and for example, the end-of-life provision was something that I offered to try and promote bipartisan cooperation. The decision was made, and you go look at what the Republicans offered.
But the bill was written in secret.
Okay, guys, all right, really, let's. I'm going to get some of the viewer comments in here. Here's from Enola Boyo3, I guess that would be New Orleans, Louisiana. He says, in the new plan, will people still need insurance to seek medical attention in hospitals, or what is the option for the poor? Go ahead, Representative Burgess.
But yes, people will still need insurance, and in fact, if they are covered through the state exchanges in the public option. If it survives, there will either be a premium that they will pay or there will be a subsidy that they receive.
Mr. Blumenauer?
If they receive a subsidy,
Yes.
their choices will be fairly limited.
The choice here is to make sure that everybody has access, either employer provided or that they can have subsidized care if they are not, if they can't afford it. And there will be opportunities for people to have more choices. I think it's very straightforward, trying to make sure that everybody for the first time has that access and that nobody in America will go bankrupt because of health insurance costs.
Well, why don't we then leave the power in the hands of the individual, like with a health savings account? Those are going to be deemed unqualified in the new plan, and many people, such as myself, who rely on a health savings account, won't have that any longer. And yet, it's been shown that that is the cheapest alternative, and that's what will hold costs down over time.
Okay. All I have to say is I can see why some people are so frustrated by this, because just trying to talk to you guys, I can't get a word in edgewise. So can you imagine what the everyday American, how frustrated they are, especially if you don't have health care or you're dealing with health care? So listen to us. We don't want the partisan. We don't want the left and the right. Nobody cares about that. People want health care reform. Work it out, please. Okay?
When we get back to Washington,
Thank you,
I
guys.
hope that is exactly what will happen.
Thank you, guys. What a long, strange